Hello everyone, how are you doing? I missed you all terribly. This is take 13, I'm pretty sure, because the last time my mic wasn't recording, and the first time I ever tried this, I didn't realize how fast 5 minutes goes. So let's just shoot right through this. And we're going to start from the beginning. And the beginning here is at April 15th, 2020. At that point in time, there were over 2 million confirmed cases worldwide with coronavirus and, COVID-19 specifically. There were in the U.S. there were 641,919 confirmed cases. Fast forward 6 days later to April 21st, 2020, those numbers jump up to 824,698 confirmed cases. 2.5 million cases worldwide. That's a substantial jump in numbers in just 6 days. Currently, as well as in recent weeks and at this point in time, states have created stay-at-home orders, have put in place stay-at-home orders. Some have extended those. Others have began setting dates on when they're planning on lifting them. But it's all changing right now. Idaho recently extended the stay-at-home order. And for this situation, I picked the trans-theoretical model because it describes pretty well what needs to happen and what people need to do to get a better control of the situation. And the trans-theoretical model is comprised of 5 steps: pre-contemplation, contemplation, preparation, action, and maintenance. Pre-contemplation is people aren't aware that their current actions or behaviors are problematic or can be considered problematic. Contemplation, people are beginning to recognize that their behaviors could be seen as problematic, and they start to look at pros and cons of their continued actions and behaviors. Excuse me. Preparation is people are intending to take action in the near future, and they begin to take small steps toward change in behavior. Action, people are beginning to acquire new and healthy behaviors and actions, habits. Maintenance, the last one, is people are able to sustain these behaviors and habits for an extended period of time, like 6 months, and are working to prevent relapse. A big one for this is hygiene, such as washing your hands. That's a big one. The fact that we've had to enforce people to wash their hands, to remind people to keep washing their hands. That's an example of a behavior. And that's just one. There are hundreds of other behaviors that you could apply this to in speaking of coronavirus and COVID-19. In the past, because this isn't the first disease that we've had that has infected millions. There was the flu of 1918 to 1919. There was H1N1 in 2010, and in that situation, in that case, again, we had placed travel restrictions, social distancing, quarantining were all isolation as well. These were all things that were done to slow the spread of H1N1 virus. Face mask use also increased during this time, although at that point in time it was still hotly debated on whether or not these masks actually make a difference. And even now, it's still up for debate. CDC, however, did recently advise that you cover your face with cloth, a mask if you have one, cover your nose and mouth. Community-wise, this is affecting everyone. From state public health organizations, CDC, national, global level health organizations. In this project, I had in mind that my population that I had in mind was people who weren't native English speakers. A majority of my family does not speak English, and for people like them, it's harder for them to acquire information or healthcare because they can't easily read English. Maybe they don't fully understand it. So it's important in your community to have the resources to be able to relay this information in different languages, not just English and Spanish. There are hundreds of other languages that are widely spoken in the U.S. So moving forward, some important things is that we cannot rely alone on a vaccine as the solution. Vaccines take a long time, and it will most likely not be ready until early next year. That is not the only solution, and we cannot rely on it. Social distancing is the most effective at preventing at increasing infection, and we have to be prepared for future pandemics. To conclude this, data is changing every day. These numbers are going to change. As of today, April 28, 2020, the U.S. surpassed 1 million cases, in addition to 3.08 million cases worldwide. Listen to medical professionals and scientists, and most importantly, be safe, guys. I hope you're all doing well. Thanks.